Welcome to This Wasn't the Plan podcast. I'm Kali.
And I'm Brittany.
And we're two best friends who met during breast cancer treatment in our 30s. This rocked our world, but we managed to get through it together. We've laughed, cried, and learned a lot along the way.
This is our real, raw, and honest journey, and we're here to help you feel less alone in yours. Thanks for listening. Now let's get on with the show.
Hi!
Hello, how you doing?
Oh my gosh, we're wearing the same thing. Okay, that's really weird. No one can see us, but we are.
Well, maybe they can if they're watching on Spotify or
That's
YouTube.
True. If you can see us, we are.
This is not planned.
It's like when couples start to look alike, like married couples, you'll see them and you'll be like, are they brother and sister? No, they just are married. So we are starting to look alike, which is great.
Would you say
pretty?
This wasn't the plan?
No, I was planning to look exactly like you all along. That was the goal, and it just so happened to happen episode 5.
Mm-hmm.
Well, how are you? I haven't talked to you, actually. Usually we talk like multiple times a day, and I haven't really talked to you today.
I know. It feels like we can actually catch up and not. No, I'm good. It was a fun weekend full of seeing friends and enjoying fall weather and just kind of all the fall activities. But yeah, how are you doing?
I'm good. We had a good weekend. We had a lot of visitors, which was nice. My sister came. We went to a pumpkin patch. Oliver declined all photos. We went there to take photos. So that was great. But we had a lot of fun.
Like a 2-year-old.
I know. It was so hot too, though. I felt so bad. There was this couple, you could tell they were coming to take family photos. And the dad was in a turtleneck and a thick jacket. And I was like, oh, and it was like 70, it was probably like 76 out, which not terrible, but with the sun beating down, I'm like, ooh, that wife is really strict. And yeah, I'm just kind of taking it easy this week. I have my Herceptin IV on Friday, which would be my 4th one. And so I'll get 4 in before my next PET scan. We'll see if 4 is enough. I don't know, but
how do you feel after those?
I feel pretty good. I'm just tired. I'd say it makes me just tired. The first one, you have usually like an immune response and you feel kind of flu-like. And then just that night, and then you're pretty much fine the next day. I had like an extended kind of a reaction to my first one at full 100%. I like to think that it was just working extra hard.
Yeah, your immune system was really.
That's my motto. But yeah, so
yeah.
I'm good.
That ties into what we're talking about today on today's episode, which is
how to decide your treatment path. Are you going to be full standard of care, integrative, holistic? Are you going to pick and choose? And, how to come to that decision. I think you and I both came to it, our decisions of how we wanted to treat our cancer like differently. But ultimately, I think it's just important to choose what's best for you and make sure you have a team of doctors and family that is like rallying and supporting you in those decisions.
Yeah, they're huge decisions. And I think things that really stood out to me about our time talking about this was just like how important it is to feel trusted by the people around you and to trust the people weighing in on those things, whether, when it's your medical team. And then the biggest thing is like, you have to believe in what you choose.
Yeah, 100%. Like if you are like just doing it because everybody else is telling you this is the way to do it, but you don't really feel it's right, I don't know how well it's going to work. I mean, maybe it will. I don't know. But I just think you may have some resentment, which, yeah, I definitely went through that in the beginning, which we can talk through on emotional trauma from the cancer episode. But I would say that I'm like, ultimately, I'm happy with the the choices I've made once I kind of was able to feel like I could make those choices on my own. And also I think it's important to know that like you can do a little of everything.
Yeah,
Like,
and there's off ramps. Like you can,
yeah.
if you started something and then you're like, whoa, this doesn't feel right.
Mhm.
You can look for other
Totally.
things and change course.
Yes, I think just in the beginning, this episode is really truly for somebody who's like maybe starting off, but also maybe they've already been doing treatment and they're like, this doesn't feel right. I'm looking for something else. What are my other options? Really is the episode for them.
Well, but I think something I was going to say is that, like, I think people sometimes feel like, well, if I do Western medicine, then I'm going to wait until I'm done with that stuff because, like, I can't do both. And that's like the biggest thing of this, like, integrative is genuine. Like, you can do those things and support your body if that feels like, don't wait till you're done with it all or whatever.
That's what I was going to say. Most of these like integrated treatments are complementary and actually like can really help when you're doing like a chemotherapy or like immunotherapy, but if your oncologist is not if he's saying the opposite of that, it's and you want to do those things, find a new oncologist because mine is awesome. He knows everything I'm doing and like supports it and yeah, like this helps with this and this helps with that. So like, that is an option to be able to like do all
Find
the
someone
things you
who
want to do
supports.
to help support your body and target your tumor. Um so yeah, I guess I don't
I
have
really
anything else to say, but I really hope you guys enjoy this and I hope you find clarity on your path wherever you are on it.
Yeah, it's muddy and no one has the guidebook and no one can help you find the perfect path but you. And so we hope that, something in here sparks some thoughts for you.
Yeah. Well, enjoy the episode.
Thanks.
Hi, and welcome back to This Wasn't the Plan podcast. I'm Brittany,
And I'm Kali.
and today we are talking about deciding your treatment path. So, we're going to talk a little bit about different paths you could take and decide between, and kind of explaining the terminology that we use and what the differences are. And then we'll talk about how we decided our treatment path and just kind of the thought process there to help someone who's maybe in the beginning stages just kind of hear the process we took.
Yeah.
Yeah. So do you want to first dive in just right off the bat to the different terminology that we use?
Yeah, so we'll reference standard of care, integrative healing, and holistic healing.
Yeah. So standard of care is what you would be offered at a hospital or a cancer center or something that Western medicine says this is how you treat the specific disease that you are diagnosed with.
And often it's treating the tumor. So you're going to have chemotherapy, immunotherapy, surgery, radiation. That's standard of care.
There's more data around standard of care because we won't get into the long details, but studies are funded by big pharma, and so they are not going to be funding things they couldn't patent, which is things in nature. So that's always the argument, is there's no data around some of the things that you do with more of a holistic lens, and that's because it doesn't make anyone that much money.
Right. Okay. And then let's say what holistic healing is.
Yeah.
That's more treating the body. So you're treating your terrain. You're going to use natural healing processes, a lot of diet, nutrition, your nutrition, supplementing, everything that treats the terrain. They don't focus too much on the tumor specifically.
Yeah, they see it as a systemic issue, and often in the holistic world, meaning I'm not like if you're true holistic, like not engaging with any of the medical interventions that would be offered. And often I hear people say that they don't want to do any harm to their body in treating the tumor burden.
Okay. And then integrative healing is basically taking the best of both worlds. So you are truly doing that. You're integrating. Maybe you're doing a little chemotherapy. Maybe you're changing your diet. Maybe you're going to do some vitamin C. Maybe you try some immunotherapy. But then you do a lot of support therapies for your body. And you're still treating the terrain, or fixing your terrain, I should say, which is your body, your whole body. and also targeting the tumor. So
Yeah, I heard one interesting thing at the center that we went to that a doctor that I talked with there had said, I see it as like there are different lines of defense, and someone who has like maybe earlier stage maybe has more options to do less engagement with standard of care, and then, you know, my decision making, which we'll get into, was more like I might need to engage in some of those pieces of standard of care to get things under control, and support my body. So
yeah, you'll often hear us say like your tumor burden, and that just means like how many tumors do you have, how big are they, how widespread are they, and you know, the more you have, the more of a burden it is on your body and your immune system. Like the smaller your tumor is, the like
your immune system can probably activate and
Yeah.
like do its job,
Yeah.
which is to take care of that. So you've referenced terrain a few times. Can you talk a little bit about what that means to you?
Okay,
Or not to you, to anyone.
terrain is your whole body and all of its systems. So I'm talking about your digestive system, your immune system, your reproductive system, your nervous system. You know, all of these systems work together to have a, you know, for your body to function. And when one of those systems isn't working properly, it affects the rest of them, right? So we're going to it's like the theory, the fishbowl and the fish. Like, do you either treat the fish or do you clean the tank? So I'm cleaning the tank, and that's your terrain. And that means, you know, like, do you have gut problems, gut issues? People love to talk about the gut because it's extremely important in terms of like all your health. Do they talk about your like nervous system? You know, your nervous system is super important because I had chronic anxiety my whole life, and that was a huge contributor to my cancer. So that was something I needed to tackle.
I think this term came from, and correct me if I'm wrong, Dr. Naisha Winter's book, Metabolic Approach to Cancer. She uses it in that, and that's
Okay.
when I discovered the term terrain, whether or not she like coined that phrase.
I don't know if she invented that term. I think the Greeks did, probably. I'm going to say that as a Greek person.
It all goes
saying.
back to Greece.
So I don't know if I'm taking credit for that, but no, I don't know. She probably coined it with her terrain 10. We'll definitely talk about that later on because it's super important in integrative healing.
Yeah, and we'll have a whole
And
episode
holistic
on
healing.
that. But when
Yeah.
you look at terrain, just know it's kind of figuring out which imbalances for you in your body are maybe indicative, and they're going to be different for everybody.
Yeah.
And then when you bring those things back into balance, your body should be able to heal itself.
Yeah.
And sometimes we integrate heavy hitters from maybe the medical world to give us a little bit of a head start
Yeah.
and be able to. So what are the different modalities that you did in an integrative path?
I did low dose chemo, so I targeted the tumor. With that, I had a pretty big tumor burden at stage 4, so I needed all the help I could get. So I did low dose chemo. That would be from that I wouldn't even categorize as standard of care because you're not going to get that in a hospital setting. That's when they like lower the dosage of chemo that they're putting in your body and giving it to you with insulin, and it's a whole process, but it's just you have a lot less side effects, and it only targets the cancer cells. So I knew that I wouldn't be harming my body, my terrain, we'll say, as much as like a full dose chemo. I did IV vitamin C, which is like high dose vitamin C intravenously, and that helps, that helps boost your immune system. It's cytotoxic to stem cells, which chemotherapy does not get.
And how much vitamin C are we talking here?
So they usually start you off at 50 grams. That's like a normal person can do that. I was at 100. That was my like therapeutic level for a year, and I was doing at least 3 a week
Of
100 grams of vitamin C.
no way.
Yeah.
Oh, I didn't realize you were doing 3 a week.
Yeah, I did a lot.
Okay.
And
yeah.
I will say, at 100 grams, it's pretty gnarly. It's not as easy, so I've heard people refer to it as gentle chemo. And I would agree, because there have been times when, like, especially if you don't eat, like, you will get sick. And I have thrown up on it. I have had, like, I've gotten a migraine because I didn't drink enough water. It makes you extremely thirsty.
It's wild. The
And you're
like
just
wave of thirst that hits you.
And tired, makes you tired.
Super tired, yeah.
But we're just boosting the immune system as much as we can.
And usually those effects, at least for me, did not last beyond like maybe a little bit after. It's not like the next day you wake up and feel like sick. Yeah. So and there's a lot of good information out there on. I mean, there's tons of studies. There's a study showing that IV vitamin C paired with chemo, it like significantly extended the lives of people with stage 4 pancreatic cancer, and yet. And it's used in other countries as a standard treatment alongside other stuff. But the other doctors won't doctors here will not really acknowledge it. So
I was also doing like IV. So I would do IV vitamin C, and then I would do like hydration, like just a bag of hydration. And then right after that, I would do sodium bicarbonate, which helps neutralize your body and get the pH levels down to basic, because cancer thrives in a highly acidic body. So we're trying to lower my pH levels. And that together, like those IVs, it would take about 5 hours, like 5.5 hours. And I would do that about 3 times a week. Maybe down to 2 once I started doing chemo. Did you do those?
Yeah. I did IV vitamin C. I only did once a week. And I did 75 grams. So they do start, as far as every clinic I've talked to, they start everyone at 50 or less, and then they run the G6PD test to see if going above that threshold would negatively impact you. Some people, I think it's like a genetic mutation, and so they want to double check that you don't have that so that you can tolerate it. And then you talked about therapeutic level. Mine was 75 grams, and one clinic that I went to, they test your blood sugar after the infusion to double check. There's like it's really interesting that your cells register vitamin C in the same way they do blood sugar. So it appears that your blood sugar is higher. It's not actually higher, but if you do a finger prick, your blood sugar will be really elevated, like 300 something. And that's how they determine if you're in therapeutic levels. Did that about once a week most of last year.
Okay, something that I loved and worked really well for me was mistletoe therapy. Whenever I tell someone I was doing mistletoe, they were like, "You mean the plant that you hang at Christmas and you kiss under?" And I'm like, not exactly. It is a plant, and, Germany, they use it. It's like one of their first line defenses for cancer. There's a lot of cancer centers there that use mistletoe therapy. It's an immune modulator, so it helps, boost your immune system to help attack the cancer. Now, if you have a high burden of disease and a lot of things that are, immunosuppressant, then I don't know how effective it is, but I was using that alongside all my other therapies, and I was seeing a significant decrease in my cancer markers. You could do it intravenously, or you can do it via subcutaneous injections.
And you did mostly IV, right?
I did the shots for a while, and honestly, it caused me so much stress because I hate needles, and I hated giving myself shots, and you do it in your stomach. My husband did it for me, and I just cringed every time I had to do it, and I didn't see as much of an effect. It's supposed to also help prevent metastases once you are not metastasized, I guess, once you maybe are in remission. And obviously I already had mets, so that wasn't what I was using it for. But the IVs just worked so well. And, I was doing extremely well in the first 12, 16 rounds of low-dose chemo because I had the IVC. I did mistletoe. Also, I was doing hyperbaric oxygen chamber. Cancer thrives in low oxygen settings. So go put more oxygen in you, That was really helpful. And I also started doing lymphatic drainage massages, which I don't know. There's no evidence on this, but I have never had any lymph node involvement. And I was I don't think this is accurate, but just I tell myself to keep doing them because it's been helpful. And the fact that creating your lymphatic system is like your garbage trucks of the waste in your body and like toxins. And if your garbage trucks are not working, no one's taking out the trash. And so it's sitting in there and it's getting reabsorbed and you're becoming more toxic. And so I really love the lymphatic drainage. That was really helpful. I still do it once a week. And
is it like a regular massage?
no.
Okay.
No, she uses like these wands that have like electricity in them kind of that helps move your lymph system like more powerfully than just like your hands. And she uses like light therapy, and it's honestly, I mean, I love the person who does it. She's been like a huge part of my healing journey. She is the one who introduced me to the Rife machine, which is like frequency healing, obviously, which I use all the time, and made you get one too. And it is, I think it's important. If you can't do a lymph massage, you should do rebounding, which is jumping on a little trampoline. You should be drinking a lot of water, exercising, anything to move the lymph system.
Yeah.
Dry brushing.
Yeah, talking about some at-home modalities, now that you bring that up, I rebound most mornings for 10 minutes. I always open my lymphs up first. I do the big 6. You can look up videos on the big 6. So I always open those up, do 10 minutes on the rebounder. I juice. I do a lot of mostly just celery juice because juices can get really high carb. A lot of divided info about, I mean, some people are like swear by carrot juice and beet juice and all of those. I tend to avoid those. I do coffee enemas. I know we bonded early over our love of coffee enemas.
Yes.
As strange as that may sound if you haven't done one, those are really, really supportive to the liver. And for both of us, we had trouble detoxing. We were also going through chemo, so it's like really important to support your body through that.
Yeah.
And in general, I have deficiencies in like getting my liver to process and break down estrogens and hormones and other chemicals. So the coffee enemas basically increase bile flow and blood flow to the liver and support it in doing its job. So do those a couple times a week. I do
Sauna
at home. Yep.
Red
and
light
after
therapy.
sauna, I do cold showers. Yes, red light therapy. I do that while I'm coffee enemaing. And
I like to stack my at-home healing protocol. So like I'll do a sauna, right? So I'll dry brush before. I will take chlorophyll. Is it chlorophyll?
yeah,
Chlorella. Sorry, chlorella. I always mix those up.
Yeah,
Chlorella, which is
chlorella,
a binder.
or charcoal,
Or charcoal.
there's a couple different ones you can do, but yeah.
Yeah, so I take chlorella, I take castor oil, and I rub it all over my liver because castor oil really helps penetrate the liver, and I just feel like it helps like
That's smart.
push the red light and the heat in there to help detox the liver.
Yeah, I actually don't do that, but before sauna, I should.
Yeah,
I
because
do
you're
it
in there
overnight.
naked anyways.
Yeah, castor oil packs overnight or in saunas are a great idea.
And I go in there, I do my sauna, I sweat, I get out my toxins, and someone told me that at 170 degrees that kills cancer cells. I don't know if that's true or not, but I didn't need to fact check that. I just do it, you know?
Yeah.
So I do that
It's a really, really supportive thing.
like 5 times a week. I try to do that 5 times a week. Sometimes I don't, but you know.
The Scandinavians are some of the healthiest people in the world, and they sauna all the time.
I know there's a lot of health benefits to saunaing. I actually haven't seen a lot of anything like harmful with the sauna, like not a lot of like controversial evidence, but I have seen there is a lot about like cold plunging. I don't cold plunge because I don't really have access, and I don't particularly like to be cold. But also there's a ton of health benefits.
Yeah,
you know?
I did sauna cold plunge for a long time at the hyperbaric chamber gym that I go to. They have that combo, but now that I have a sauna at home, I just do a cold shower after my sauna.
Yeah.
And I think, yes, it is very divided. If it's good, if it's bad. I think a lot of people's opinions have to do with women and their hormones. And since we're in medical menopause,
Yes, we
I'm
are.
like, you know what? That doesn't apply to me right now. So I think at the very least, cooling my body down after sauna. Yeah, so those are some at-home therapies that we do.
And we would classify that as like holistic, right? Because that's like that all those things that we do at home are supporting our bodies, supporting our terrain, you know, helping our body be as optimal as possible to fight the cancer, but also doing stuff that are treating the tumor, lowering the tumor burden.
Before we move into like what we do that's standard, do you want to talk a little bit about frequency healing? There's a few things that I qualify as that, and I'm going to talk about a couple, and then I want you to talk about Rife, because that has been a big part of your treatment.
Yeah.
So there's all kinds of evidence that there's we are energetic beings, and everything holds a frequency. The trees that you see behind us hold a frequency. The grass does. The earth does. The
pathogens.
The pathogens do. So the cancer cells hold a frequency. Every cell in our body holds a frequency, and so there are all kinds of things you can do that are really not harmful to your body at all, that actually support your body to heal. So some of those are things like the quantum bed. That's a newer one with not as much information out there. I did that a lot when I was in California. Another one that we both did quite a bit is the biomodulator, biocharger. If you don't know about voltage or you don't know about frequency, we're not going to get in depth on this episode about that at all, but I think looking into Dr. Jerry Tennant's work, he's kind of like a, the godfather for us. I almost said the grandfather, and I'm like, that's not the right word.
He probably wouldn't appreciate that.
He wouldn't appreciate that. We're going to say the godfather.
Yeah. Ages him quite a bit.
So anyway, those are some, and one that we do at home is we both do Rife.
Yeah. So I got a Rife machine like later on into the diagnosis, and that's frequency healing that was created by Dr. Royal Rife in like the 30s, and he realized that through scientific studies that every pathogen, every virus, everything has its own frequency, like you were saying, especially cancer cells. And if we can get the frequency that can neutralize that cancer cell, then that could be the cure for cancer. Nobody likes to hear a cure for cancer. I actually don't know if there is a cure for cancer. I think it is a perfect, like the perfect storm that created the cancer.
Not a magic bullet.
There's a perfect storm that can help hopefully help eradicate the cancer. But this has been a huge healing tool for me. It's helped me. It's really helped me in my healing. And basically, it's just frequency. It's a computer that has the program on it, and then it has these light bulbs that emit the frequency to you, and you just basically like lay next to it. You can put it on your body if you want. I do it every night. I run a breast cancer program. I run a cancer overnight program, and I have seen, my tumors have shrunk. It's pretty remarkable. I do other things too. I don't want to say that is the only thing I do, but it's absolutely helped support my cancer journey. And I did not know about frequency. That was something that I found out about through talking to people at my center that I, we're doing more like integrative cancer care. And I'm just like always so grateful that I learned about it, because, everybody's body is different and will respond to things differently. And I feel like I finally found my recipe. And that was like the main ingredient, I'd say.
Yeah, I know. When you started really, I think was the first indicator that was going to work was your intuition. You were like, I know this is going to work. And then you started seeing cancer markers drop. And I think your circulating tumor cells
went down
to
0.8
to like really,
from 26.
Yeah. Well, it was like 6, and then it went up.
Yeah. Then it went
shot way up because of the die off.
I believe it was die off.
It had to have been.
I had a new liver tumor before that, and it was like a very high SUV score, very, very high for me. And when I went for my next PET scan, it was gone. It had been resolved, is what they say medically, and they couldn't even see it anymore. So that was the only thing I was doing that was like neutralizing cancer cells. I was on hormone therapy, but I had been on hormone therapy, so it wasn't like it was new hormone therapy. So I want to say like I was also doing some standard of care stuff.
So let's kind of talk about that piece, because I think we've kind of covered all of the like holistic stuff that we do at home or in clinics. So what are some things that you've done throughout your journey that's standard of care?
So I did immunotherapy. My cancer was HER2 positive. So that means there's a targeted therapy called Herceptin Perjeta. It's an IV. It's an immunotherapy. It helps target the HER2 proteins on the cancer cells. It's not without its side effects for sure. At the time when I started in May of 2024, I got my diagnosis in my stage 4 diagnosis in February of 2024. I was throwing everything at the cancer. So my oncologist, my standard of care oncologist said, this is a lot. Like, we are doing a lot. I don't want your body to become too toxic. I think we should do it at 50%, which is very rare. Most,
I was going to say, is that like...
That's not normal.
Okay.
And he told me not to tell the nurses.
Oh.
I mean, they knew, but like not to discuss it with them.
Okay.
Kind of a thing.
Okay.
And I was like, all right, I don't care. So we did it, and we didn't do the Perjeta. We only did Herceptin at 50%.
When was that? That
was May of 2024. And I did it for about 7 months until I had progression, and I just stopped it because I don't think it was I don't think it was working for me. I think I needed the Perjeta. You think you needed
I
did, yeah. Okay. I think it's a pretty helpful. I mean, they work best in tandem.
And what held you back from doing Perjeta with
just my oncologist? He said he told me that it was a chemo in there, a chemo agent, but that's not accurate. So I don't know. I must have misheard him or something. But he just thought that it would be too toxic for my body. I wouldn't be able to handle it because I was also doing low dose chemo, CDK4 inhibitor, tamoxifen, and that just would have been too much for the body. So I was like, okay. I mean, I trusted him. I had a great oncologist at that time. And then other standard of care, because the cancer was hormone positive, was tamoxifen, which blocks the blocks the estrogen. It doesn't feed the cancer. I was like 97%. I was 97% estrogen positive. And then the CDK4 inhibitor works in tandem with the hormone blocker to help. It's actually a first-line defense for ER positive, PR positive, HER2 negative cancer. Even though I was HER2 positive,
I've never been recommended to have that one, but
yeah,
okay.
We for metastatic cancer.
Oh, okay.
Yeah, and so that's what I was doing in terms of like standard of care.
Gotcha.
There's definitely side effects.
Hormone blockers that you've done at different times: tamoxifen, Zoladex,
anastrozole,
and that is an aromatase inhibitor.
Yeah, that's a hormone estrogen blocker.
Okay.
I should say, like, these pills and the standard of care has different side effects for everybody. The anastrozole that I'm on, the hormone blocker, it really causes a ton of joint pain.
Yeah.
I mean, I feel it every day. Like, it is very painful. Tamoxifen, I had no problem on it.
Did you have any side effects that you noticed?
No.
Okay. Yeah. Is there any other standard of care that you...
No.
Okay. Let's see. So whether or not you classify low-dose chemo, it would be integrative. It's not standard of care. That is something I did. And one thing I'll say about that, like, we always joke that, like, I have a strong constitution. I think it's just, I don't, I'm not super sensitive to things. Sometimes that's a bad thing. Like, I think that part of that is how I got a cancer diagnosis, because I just didn't notice things in my body going on.
Yeah.
A good side of it is I didn't really have many side effects from chemo ever, and I got to a pretty high dose.
Never.
And I'd just like roll in being like, what's up? I'm good. But
I remember I invited you over for dinner one night, not realizing you had chemo that day. And then you told me when you came over, yeah, I had chemo today. I'm like, how are you operating like a normal human right now? Like, we're having chili. Like, how are you having chili after chemo? Yeah, you have an incredibly...
I drove my way down to... Yeah.
I couldn't even look at chili. I'd probably throw up after chemo.
Yeah, and so I am grateful for that. But, one thing that was really interesting, because I just kind of expected to tolerate everything pretty well. And my very first round, they had me on kind of two of the standard... Like, so I think people might wonder, are you using the same drugs that, like, a hospital would? Yes, it's the exact same drugs, it's just a lower percentage.
Same chemos,
And so there's one AC. It's like doxorubicin cyclophosphamide. People call it the red devil. It's red in the bag that they put it in. So that's how you know if you're getting it. But it is one that for sure comes with the worst side effects if you do it at a standard dose. And I did those at a 10% dose my very first round. And I felt fine, but like I didn't know at the time. I didn't tie this together, but I had like liver inflammation. It was just like pressure under my right rib cage. And I was like, oh, that feels kind of weird. And of course, like when you have cancer and you're just starting treatment, you kind of are on edge about any ache or pain.
Of course. Yeah.
And then you always do pre-chemo labs a couple of days before to make sure your white blood cells are okay and everything, like your kidneys are looking fine so that you're okay to do it.
Yeah.
And my liver enzymes came back, like, I'm talking, they are through the roof. They're like, one was like 245 and they're supposed to be like under 40.
Right.
So even like you said, I'm like, maybe I'm really grateful that I never did a full dose, because if 10%, if that was my reaction, like I think I probably would have been like hospitalized.
Yeah.
So that is, again, one of the reasons that we both chose to do a low dose chemo. And then I started hormone blockers people call them hormone blockers, endocrine therapy, hormone therapy. They're all kind of the same umbrella, and there's all sorts of drugs within that family. Zoladex is the one that's like a massive needle that goes in your belly. Lupron is another one, I believe, that goes in your butt. But they both shut down your ovaries and put you into what people say is like medically induced menopause. So some women are recommended, and I honestly, they might do this for I have to check, but for when you're doing chemotherapy, if you want to protect your ovaries, they give people this injection, whether or not, like I have a friend who has triple negative breast cancer, and she was doing it to protect her ovaries, and she was doing standard chemo. But for me, that one, I think, really brought down like by the time I started it, which was in like July of 2024, so 7 months into my diagnosis, I was having like stabbing pain in my breast like for the second half of my cycle. Wow. So it was just like the estrogens rising, and it was always anxiety inducing. It was so hard to even function because it was always just like this knife in my breast. So as soon as I got the Zoladex started, that went away, and that was really it eased my mind a little bit.
Yeah.
Doesn't come without its side effects. Not everybody has hot flashes. You are a lucky one. I have really, really gnarly hot flashes. My oncologist said that I probably would, because I'm 31. I was 31 when I started, and so like the younger you are, the more dramatic the hormone shift might be. And also, you know, I think like my mom had hot flashes, my grandma did. Like I think how people have gone through menopause in the past of your family affects that. So that is probably one of the worst side effects. I think another one that we've talked about lately is weight gain.
Yeah, that's been a fun
surprise.
I wasn't expecting. And I remember like talking to you and being like, I feel really soft lately, like out of nowhere. And then you were like, well, you probably already know this, but one of the side effects for Zoladex is weight gain, like 20 to 30 pounds. And I said, I did not know that. Nobody told me that. And so, yeah,
that's just what one of the nurses said to me. And it is very weird, and it's an invitation to further healing, because I was at probably like one of my lowest weights during chemo, and that is a combination of things. That's dramatically shifting diet and eating incredibly clean, and also chemotherapy and cancer. You know, people say like there's cancer butt and like all of this stuff.
Yeah, and I was a victim of cancer butt.
Me too.
Well, chemo butt, not cancer butt. Chemo butt.
Yeah, either way, they were gone. They were just not there.
Your butt just disappears.
And so anyways, I think it's been weird to then be like, oh, now I'm eating the same foods, I'm living the same lifestyle, and all of a sudden my clothes aren't fitting quite the same. So.
I know. Yeah, I was the thinnest during chemo for sure, because I was on like a keto, very strict keto diet. I was doing chemotherapy, and I was pretty sick on those days. So I wouldn't eat for like a day, 2 days. These are not diet tips at all. Just want to say that. So I was very thin, but you're not really, the last thing you're thinking about during chemo is like your weight. You're just trying to get through it. But clothes fit me a lot better. And then all of a sudden, like this year, I'm wearing my clothes. I'm like, they're getting a little tighter, and I haven't really changed my diet too much. Every now and then I'll have a little ice cream, but is that really going to gain?
Little treat culture strikes once in a while.
Yeah, am I going to get like 20 pounds from ice cream? No. So that is, the thing about side effects with standard of care, I think there's like two sides of it. There are two people. So there's the type person who wants to know all of the side effects. They want to read everything about it, and that makes them feel better. Then there's the other side that like doesn't really want to know all the negative side effects, because especially like the rare ones, because it might scare them into not doing it, or they might feel like they have it, or hypochondriacs tend to not want to know that kind of stuff. And so I'm kind of like in the middle. And when it comes to these things that I really have to do, like I really didn't have a choice. I had to do these things. Like I have to do Zoladex. I had to do low dose chemo. I had to do these things. I didn't want to know too much. I had my husband look up like Reddit threads for like the CDK4 inhibitor, and it was called Ibrance. And just the most common side effects was like diarrhea. And I was like, okay, I guess if that's what's going to happen, that's not that bad. I didn't read anything else about it. I didn't get that, thankfully. And I think it was because I had worked so much on my gut by the time I had taken it, that I just was able to handle it really well. But, I just think it's important to, acknowledge that there will be side effects, but not worry too much about them, because, and I feel like this kind of transitions into how we ended up deciding like which route to go, standard of care, integrative, holistic. And if I can just say, I was bound and determined to treat cancer holistically. I was like absolutely against tamoxifen. I had read too much about it. I was against chemotherapy. I was just reading all the bad things. And I was only I don't want to say only, but I was stage 2 in the beginning, and I thought, okay, I can do this, Well, what I didn't take into consideration was that I had a newborn baby. I was trying to do crispy cancer, which is juicing and
3 coffee enemas a day.
Oh, okay. I didn't do that, but it's like juicing all the time and salads, and nobody else was eating that way. So it's like, okay, am I going to cook that for myself, or not even cook? You're not cooking, creating those things for myself.
Cut that for myself.
Yeah. And then I have to feed my son and then my husband. And then we always had someone staying with us, even though they were cooking. It was just a lot to manage. Like I was like, and then I told you, I never wanted to eat a salad again after that. I was so burnt out of salads, and it just wasn't attainable for me. And then like with tamoxifen, I had read too much about it, and I was so scared to take it. And then when I got to the integrative center and they said, you need to be on it, I was like, are you sure?
Oh, same.
Are you sure?
That was one of the hardest meetings. And I was like, no, you are the people who are supposed to tell me not to, like, that I don't need to do this.
That I could eat some grass and that'll do it, And they were like, no. And I was like, well, what about the studies showing blah, blah, blah? And he said, we don't really see that. It's like long-term use. And even so, that doesn't always happen. Like, we really feel that you need to take this. And, it kind of changed my perspective. And so in how I determined, like, what I wanted to do, I'd say it was a little trial and error. Like, okay, tried this, didn't work, tried this, didn't work. And then I just ended up feeling, I just felt the best when I was bleeding both, or what's the word? Like using the best of both worlds. And, I listened to my oncologist, what he had to say. I listened to my integrated doctors, what they had to say. And I just kind of had to like ultimately choose what I was feeling the best at, because they're not in your body. And don't you feel like sometimes, like holistic doctors, they ask a lot of you, even actually standard of care, they're asking a lot of you to do all these things, all these treatments, take these supplements, do these do these treatments, and they aren't in your body. They don't know how you're going to respond to these things. They don't know how you're feeling, and some things just aren't right for everybody.
Yeah.
And
yeah.
And like finally, like knowing my body, like I knew my body. I knew that if I did full dose chemotherapy, like you said, I know I wouldn't have handled that, because I barely handled low dose. And I just know it would have wrecked my body. I'm so sensitive. I have no constitution. While you have a strong constitution, I'm over here like the constitution hasn't been written, you know? So I just knew it wouldn't work for me. And I was right. And like but they don't know that. That's what they give to people. Like, well, yeah, you're going to be sick. You know, that's what chemotherapy does. But it's like, no, I don't want to be, no, I'm talking about like, I don't think I would have made it through that, you know? How did you, like, how were you in the beginning? Because I feel like you were kind of the opposite of me. Like, in that you wanted to maybe go more standard care.
Yeah. No, I think okay, so I had like already really started years leading up. I was very interested in nutrition. Like, I'm very sciencey, and like I love to learn about all of the little stuff about nutrition and the body. So when I say that, that's because I think there's a lot of different like paths people take in the crunchy sphere.
Yeah.
And some people are very like against the medical establishment and all of that, and like that's not necessarily me. And I think I would have probably done standard of care. I think I'm very grateful that I found the path that I did, and it feels the most genuine and true and right for me. And especially, you know, with the goals of having children someday, like they always say it's just kind of a crapshoot, and they want you to freeze your eggs just in case you might, like, you know, all the things that come in with that. So I did feel a lot of anxiety around standard of care, but I don't think you don't feel anxiety. Like, I don't think anyone's excited about it. So for me, it was hard to sift through.
Did you feel scared not doing standard of care?
Very.
Okay.
Yeah. I think like, whereas, you know, when you focused more on the things that could happen if you took tamoxifen or if you blah, blah, blah. I think mine were like, what if I don't?
Right.
What if I don't, and then I let it get worse? Or, you know, then I have regrets that, like, I didn't do what someone told me to do. And so it took me some time to wrap my head around it. And so when I found integrative, it felt like I found my happy place, my safe place of, like, they're not, what I remember saying and thinking a lot is, I need to go somewhere that they don't have an agenda, and they're not going to hide things that might help me to fit that agenda.
Right.
If you go to standard of care, they might see patients who do better if they take ivermectin, fenbendazole, or do vitamin C, or whatever the cases are, but they don't have the data to prove it, and they can't make recommendations if there's not data.
Right.
And so that's their prerogative, and that's like the limitations they have. And then same with like the holistic world, you've got people on podcasts saying, if you even, you know, do low dose, like that, you know, they talk about the really, really negative and kind of fearmonger in that way.
Yeah.
So I needed to find a place. So anyways, that was, I prayed a lot about it. We took a little while, meaning like 6 weeks, to just be very intentional with like what steps were taken. And it really helped me build trust in my intuition and myself, saying, okay, I found a clinic and a provider and a team that really align with me, and I have seen results that I'm happy with.
Yeah.
And so that was really special to just be like, okay, I'm starting to trust myself more with other decisions I'm making.
Yeah.
And I've always been a second guesser, and I need to ask everyone for their opinion, and I'm finding myself doing that less.
I think it's something to note that there's a lot of pressure to do standard of care, not just from your doctors, but from people in your life, because it's all we've ever known. Like, to treat cancer, that's the only thing I'd ever heard of. I didn't know about integrative healing, holistic. I didn't even think about cancer, you know. So I would say there is a lot of pressure, and it is hard to go against the grain of what an oncologist is telling you to do, your family might be telling you to do, your friends, people that you care about. But and I kind of, while I was like very afraid of standard of care, I was like bound and determined to do holistic care. I remember still having a little fear of being like, okay, this is my decision and I'm into it, but if I don't do chemotherapy the way they said I need, am I going to die? And it's really scary to go against what people are telling you. But then of course I, shifted my mindset, and then I was like more open to other options, other forms of it, other forms of chemotherapy.
Yeah. I think you just said something that highlights a really good point. And that is that you have to be okay with it has to be your decision, because a lot of people are going to have opinions around you. And at the end of the day, if the results aren't what you're hoping for, the bitterness and the resentment that you're going to feel towards someone who coerced you into something is probably going to be the most harmful thing ever for your health.
Yeah.
And that was the biggest thing for me. I was like, I had people in my life who wanted me to do standard of care. I had people in my life who wanted me to do holistic. And for the most part, everyone was very respectful that it was my decision to make. But I was very aware that I would be disappointing or scaring people or worrying them. And I was like, I have found, like the best of both worlds, like you've said. So I think just be at peace with your decisions and make sure it's something that you can back.
I also think being open-minded. I was not open-minded, and that took time to be that way. I was kind of like, I'm not doing standard of care and I don't want to hear about it. So I closed my mind to that, and I don't think that is healthy. I think being open-minded, taking in all of the information, all of the options, because at the end of the day, having options is a gift. When you have no more options, that's where it's tough, and that's where you don't want to get to that. And so the fact that I had all these options, I wasn't even seeing that as a gift and something to be grateful for. And if you had asked me at the beginning what I was going to do versus like 6 months later versus a year and a half later, like it changed, because you just don't know what you're going to do until you're in this seat. And like, if you had asked me about chemotherapy, like before I was ever had breast cancer, I would have been like, no, I'm never going to do that. I would never do that. I would never do that because I'm so sick and I would get so sick, whatever, all the reasons. And then I find myself in this position and doing low-dose chemo, and, you'll surprise yourself. But I do think it's important to just be open-minded and don't say no until you have all your options and you can weigh them and make the best decision for yourself.
And I know we're wrapping, but I think one thing to be wary of is like Facebook groups, because they are incredibly full of people who are in a heightened emotion state. And I think it will close you off to being open-minded. Yeah. And it'll put you in a fear disposition, and it will confuse you more. And I just ended up kind of muting most. I mean, if I need information from something, I might like go search it. Yeah. But I don't know. I never found helpful stuff, and there were some where I was just like, wow, I actually have to leave this.
Yeah. In fact, they put me in some support groups for like young women with breast cancer, and there was a Facebook group, and that was honestly another just like reason. Well, I already knew I didn't want to do standard of care, but it furthered my reasoning because I was just hearing the negativity, it was awful. It looked terrible. I didn't want to be a part of that. And, that wasn't helpful to me. I don't think those things are helpful. I think they're too negative. And going through cancer sucks. It's hard, but I don't know, focusing on that isn't going to be helpful to making your decision or even getting through it. So, should we wrap up?
Yeah, I think that that really covers it. I think something that popped in my head that we didn't talk about is supplements and repurposed drugs. Those are two things that we also do. Oh, you're right. There's so many things to keep track of. Yeah. But I think that's a good recap of the process that we took. Both very unique and very different and coming from different angles, and kind of landed in a similar spot.
Yeah, definitely. And, no matter what you do, just make sure you're the one choosing it.
And you believe it.
And you believe in it. Because you are the most powerful. Your mind is the most powerful tool you have. And whatever you choose, you got to believe it's going to work so that it does work.
Amen.
All right. Well, thanks for listening.
Yep. Have a good one.
Bye. Thanks for listening to our podcast. We have a big favor to ask. Please hit subscribe and leave a review. It really helps people find us.
Thank you so much, and see you next time.
Bye.